Welcome to the Feeling Lighter podcast. I'm Coach Tyler here today, as always, with the lovely Dr. Lisa.
Hi, Tyler.
She's laughing because we were just about to start, and then Lisa was like messing with her hair a bunch, and I was like, "Wait, are we ready? Are we not ready?"
They don't understand,
We don't
this
understand.
afro, it's a whole thing. But
Oh, man.
I'm
Well, it
doing
looks
well.
amazing.
Thank you.
Well, you know what? We have so many amazing guests that come on this show and give us so many different perspectives and help our listeners just give themselves a lot more permission to like themselves. And I think today we're going to accomplish that,
That's
right?
for sure.
And so I've been really liking to slide in with some of their own words, right? So our guest today is Ragen, and the post that I pulled from your social media feed said, "The diet industry has been perpetuating a fraud from the beginning. Even though the short-term weight loss followed by long-term weight gain are both parts of the same biological response, diet companies will try to convince you to credit them for the first part, blame yourself for the second part, and try again. We don't have to buy their lies or their products." I'm curious if you can expand on that post.
Yeah, sure. So I actually got into all of this over 20 years ago now, and I was looking for the best diet, the diet that had the highest efficacy. And my background is research methods and statistics. And so I decided that I would figure this out by performing a literature review of the weight loss research. And
Seems like a great idea, right?
I love it.
Yeah, I should say I wasn't in school at the time. I didn't publish. I had a corporate job. This is just the kind of mega nerd that I am, that this is how I approach my life
That's right.
problems.
That's why we
love
love
it.
you.
So I did, hours and hours of reviewing these studies. And when I got to the end, I was so surprised by what I found that I actually did the entire literature review a second time. And what I found was that for the vast majority of people, almost every intentional weight loss attempt includes short-term weight loss and then long-term weight regain. And studies show that up to 66% of people will regain more weight than they lost. And I'm not saying there's anything wrong with being fat or becoming fatter. I think there's something seriously wrong with something that's considered a healthcare intervention that's prescribed to about 70% of the population, now starting at age 2, that has the opposite of the intended effect the majority of the time.
When
And
you say
that's
the
what we're
majority,
talking
do you have
about
a
here.
statistic on the majority of the time this isn't working?
So the studies go from about 80 to about 95%.
Wow. So at least 80% of people who are recommended this end up gaining all the weight back. It's not doing what they had originally intended. And of course,
Right.
there's mental health consequences to this as well.
And physical health
And
consequences.
And physical health. Yeah.
Yeah. Weight cycling is actually linked to almost every health issue that gets blamed on being higher weight. So when we talk about these quote unquote weight related health issues, we might actually be talking about weight cycling related health issues and weight stigma related health issues.
There we go. Okay, Reagan.
Mic drop in the beginning.
I've been following Reagan a long time, and that was actually a great post to pull because it is indicative of the gems and the knowledge that she posts all the time. So thank you for that. Can you tell our listeners, I know that this started as a research study for you, but what came from that? So once you did that, tell us a little bit about yourself and how that information impacted the work that you now do and the education and the information that you put out to the world now.
Yeah, so at this time, I was just thinking about this for me. I wasn't thinking about any kind of wider implications. And so I finished these 2 literature reviews, and I was like, well, I'm a fan of math and I'm a fan of logic. And so obviously, this whole losing weight to become healthy thing is not the path that I'm going to take forward. It doesn't make any sense. And that got me digging into, okay, what would support my health? And I always want to be super clear. Health is a really gooey, amorphous concept. It's not an obligation. It's not a barometer of worthiness. It's never guaranteed, right? But given that my personal prioritization of health, I was like, what do I do? And that's what got me into literature around basically weight neutral health options, right? Where we're trying to support health directly rather than trying to manipulate body size as a path to health. And so I was on this path on my own, really just not thinking of it as a bigger thing. And I started to compete as a ballroom dancer.
Ooh.
And I had these wild experiences of weight stigma with judges. I remember a judge saying like it was such a waste of my talent at this size. And it sort of culminated in a judge kind of like backing me up against an elevator, telling me repeatedly she couldn't stand to look at me. And And I realized, and I came out in Texas in the mid 90s and had done queer and trans activism. I had been doing learning anti-racism solidarity work. So I understood social justice, but I'd never applied it to fat people. I'd always thought of that as sort of like a me situation. And sort of in that moment with this judge, I realized like, oh, this isn't just me. Like fat people are a group of people who are being oppressed. And that got me started. I started a blog called Dances with Fat. And I was just planning to kind of write about my own experiences. And then I started to write more about the research, more about the civil rights aspect. And that blog got popular. I started to get asked to speak about it. And I ended up in 2012 moving to this work, speaking and writing about this full time. And so then I've just sort of ever after been, you know, deepening my expertise in the research around this and the social justice implications around this.
I got to hand it to you. 2012 full time on this subject. I mean, that's like way ahead
before
of
it
the
was
curve.
really popular at all.
Yeah.
Obviously there's a lot of luck and a lot of privilege that goes into that. And when I started my blog, it's unbelievably embarrassing now, but I did not know there was a community of people who did this. So I was saying things like I was the first person who thought of it. And then somebody said like Marilyn Wan already said that. And I was like,
Who?
wait, what? And so I learned, oh my God, there's been this community since the 60s before I was born doing this incredible work, mostly led and begun by Black women, right? And that obviously gave me this entire community and mentors and people from history to draw upon and to learn from. But yeah, I feel really lucky. I always say that I ended up with a dream job that I wish didn't exist.
Ooh. That's a great way of putting it. And I was going to say all of the beauty you put out into this world, you know, kind of stemming from these very ugly and nasty and mean scenarios and dealing with weight stigma. And just, you know, I assume most of our listeners are aware, but in case they aren't, can you sort of broaden the understanding of what weight stigma looks like and, you know, touch on it as you mentioned, you talk about discrimination when we're talking about people of different, you know, ethnicities, races, colors, and people, you know, of different sexual orientations and whatnot. That is one thing we're very aware of, but I don't think everybody knows that people in large bodies are like actively, regularly discriminated against. And there's not a lot of pushback to it either. So if you could talk about that a little bit.
Yeah, sure. So weight stigma is going to be any time that somebody's treated differently, worse, inequitably because of their size.
Yeah.
And so it can be everything from, you know, I can walk into a mall and there might not be a single store that sells clothes in my size in a mall, right? It can be I try to get on a plane and they haven't built the seats to accommodate me, so they want me to pay twice as much as the person next to me for the exact same service, which is travel from point A to point B. There's good research that shows that higher weight people are hired, paid, and promoted less than similarly qualified thin people.
Yep.
And I also want to point out, so weight stigma is, I have learned from Black scholars, rooted in and inextricable from racism and anti-Blackness. And I really highly recommend folks like Sabrina Strings' Fearing the Black Body, Deshaun Harrison's Belly of the Beast, Joy Cox, Fat Girls in Black Bodies, E.K. Delphine's work, to really understand that and how it's always going to disproportionately impact people of the highest weights and people with multiple marginalized identities, and including and especially Black and brown folks. But weight stigma has real impacts on, and my area of specialization is healthcare.
Yes.
And so higher weight people are treated differently by healthcare. And by and large, the healthcare system was created using research that excluded higher weight people.
100%.
And so then when healthcare doesn't work as well for us, they blame our size instead of the fact that healthcare wasn't built for us. So, and that's like a big old can of worms that I don't necessarily need to open right now. But
I might say open it because I think that's important to highlight for sure.
But yeah, so it's in healthcare, basically the way it goes is that healthcare creates and perpetuates weight stigma and weight cycling and care inequalities. And then it blames the negative impacts of those on higher weight bodies. And then it uses those negative impacts to justify more weight stigma, weight cycling, and healthcare inequality. So it's a vicious and deadly cycle for higher weight people who are seeking healthcare.
You said that really fast, and I want to slow it down, right? Because we talked about this in the beginning, the stats that weight cycling could be actually the issue with people having health issues in the long run. And then you're saying that doctors are still propagating weight cycling as the main, or not necessarily weight cycling, but they're propagating the first part, right, which is weight loss, as the main thing to focus on, which causes weight cycling, which causes health issues, which propagates more, pressure to lose weight. And so it's like a downward spiral, right? People aren't getting the health care they need, and they're not getting seen, and they're not getting recognized as whole humans. They're getting recognized as broken humans when they walk into a doctor's office from day one. It's not fair.
Exactly. And so much of medical education, and it really can't be overstated how much the weight loss industry has over decades infiltrated and manipulated the healthcare industry and is still doing it today. But a lot of healthcare training teaches folks to see higher weight people as walking, talking pathologies.
Yep.
Right? Yeah. And so the assumption is no matter what's wrong with you, it's probably because of your size, even though thin people get these same health issues. Right? So why don't we're going to try to get you thin first, and if that doesn't solve all your problems, then we'll consider the thing that we would have given to a thin person the day they walked in. And that's where you see a delay of care, unequal care, gaps of care, and the prescription of interventions that have a century worth of complete failure as their track record.
Talk about that. Let's talk about this idea that everything is blamed on weight, and so the solution must be, let's create a medication or a surgical procedure that we can then gain more money from and have you do this thing and create a disease in your body when one may not even be in existence, and then see what happens after that. Like when I think guinea pigs, like that's literally what's happening to people, because we're just going to blame you for the body that you exist in and try to change that, and then when everything goes to crap from there, well, dang, you're bad. Like, you shouldn't have been big in the first place. I don't know what. Yeah.
No, you're exactly right. And this is the thing. It's been sort of escalating, right? So it was, first it was, oh, you don't want to be fat because it's not quote unquote attractive, right? Based on this stereotype of beauty based in thin, white, cis-het, able-bodied youth. But then it was, well, if we could call this a health issue, think of how much more money we could get. Right, so that it's just been systematically, and then if we could lower what's considered the threshold for being, quote unquote, too heavy, then we could increase the market even more in 1998 by 29 million Americans overnight.
Can you tell them what happened with that? I don't think everyone knows.
Yeah, so this is a real moment. So there was an NIH committee, and it was made up 7 of the 9 people represented the weight loss industry, and the committee chair was a current board member and former executive director of Weight Watchers. And they convinced the NIH to lower the threshold of what was considered quote unquote overweight based on the body mass index, which is a horrible measurement in every regard. And so they literally made about 29 million Americans quote unquote overweight overnight. And they did this to adhere to the World Health Organization numbers, but those were driven by a group called the IOTF, the International Obesity Task Force, which paid for the entire meeting where the WHO decided this and drafted the papers and bypassed the WHO's editorial process. And the IOTF was completely funded by the pharmaceutical industry. So like from the beginning, there is such, like I said, it just can't be overstated.
I'm speechless on that one. I mean, for like somebody from Weight Watchers being in the room and saying, oh, we should call everybody, who's down here overweight or obese, and then that way we have more justification in how we can shame people into doing our programs, basically.
Yeah, the guy's name is Xavier Pais-Sanier, and he is like a golden example of taking money from the weight loss industry and manipulating the healthcare industry. I don't know anybody he hasn't taken payments from. And so he comes up a lot. He's won a ton of awards from the weight loss industry. Like he's been in it, but there's a lot. He's certainly not the only one.
Wow. That's big. That brings me to another quote that I printed out today too, which I think is so important because this feels like at least what I think maybe the solution should be. And that's shame and blame around a healthcare diagnosis does not do any good and can cause harm and disengagement from care. The only ethical approach is blame-free, shame-free, future-oriented care. And I think that's so important from multiple angles. I think that when we create that shame and that blame, people feel awful about themselves. Their self-esteem goes down, their self-worth goes down. And when our self-worth goes down, the likelihood of us showing up and just trying to take care of ourselves goes down, like you're alluding to, both in the healthcare system and in just like wanting to connect with people or go for a walk or, things that are really positive for our overall health and happiness. And so how do we start to make that change?
Yeah, I think first of all, and this really applies because the weight loss industry is working overtime right now to try to solidify this idea of quote unquote obesity as a disease.
Yeah.
Right? Which is basically pathologizing bodies based on just shared size rather than shared symptomatology or cardiometabolic profile like we would see in actual disease diagnosis. And so I think it's important that when we're speaking out against this, we first and foremost say there's no shame in having a disease of any kind. The problem in this situation is that simply existing in a higher weight body doesn't qualify as a disease, right? This is, again, driven by the weight loss industry and not good science. But in general, when we create a bunch of shame around existing in a higher weight body, when we blame existing in a higher weight body for literally anything that goes wrong in a fat person's life, then we create shame around these diagnoses that people of all sizes get, right? But when a higher weight person, for example, gets diagnosed with type 2 diabetes, I talk to people all the time who were like, I was feeling good about myself, about my, health habits, and then I got this diagnosis, and I'm like, well, maybe, it's time to try to lose weight again, or maybe this didn't work, and they have just a ton of shame around it. I must have gotten it because I was fat. Mm-hmm. And we say, well, look, then people get this too.
They do.
Right? And they deserve treatment just like you deserve treatment. And the idea that being fat is the reason is, again, based on this incredibly shaky science on a lot of different levels, and based on this weight loss industry manipulation of not just healthcare, but public health messaging.
Yes.
Right? And so then when you create that shame, so then that person is less likely to get help, to seek treatment, to understand the options for managing their type 2 diabetes, because that shame leads to disengagement from care. And so weight stigma in a lot of different ways leads people to disengage from care, because when you tell someone that their body is horrible, their body is bad, their body is a sign that they're immoral, that they're gluttonous, that they're a drain on society, people are going to believe that. And then that creates internalized weight bias and stigma. And so then people say, well, my body is not worthy of care.
Yeah.
And then they don't care for it. And then all of the negative impacts of that get blamed on them being higher weight. And so it goes right back to that vicious cycle that we talked about. So shame and blame have no place in healthcare, have no place in public health messaging. It should be blame-free, shame-free, future-oriented care. And that care should be weight inclusive and weight neutral.
There's so much shame in healthcare. It's insane.
There
It's
is.
like everywhere. They just want you to feel bad about these decisions that you made to end up where you're at. And like you're saying, when you're in a bigger body, they're going to blame it all on weight.
Yeah.
Always
Well,
going to blame it all on weight.
I think the premise to it is they want you to believe that where you are is because of the decisions you've made, when in fact that's just not really true.
Sometimes it's just,
It just is what it is in a lot of cases. And I think the messaging fails in the beginning when we are under the impression that we have full control over our health.
Yes.
And I get it. I know that we all want to feel empowered and we all want to feel in control, and that's why we dieted, and that's why people ended up in deep in eating disorders, because we want control. But I think the best thing that comes out of a lot of this work is letting go of this false sense of control. You cannot control everything. You can eat all the quote-unquote right things, move in the quote-unquote right way, get sleep, meditate, all these things, and you can still be injured. You can still end up with a chronic or, life-altering disease. Like, we don't have full control. Our genetics play a role. Our environment plays a role. There's so many things we have no or minimal control over. And I think once people kind of make peace with and accept that very uncomfortable truth, right? Because I do want to have more control over my health.
You don't.
But once you accept that uncomfortable truth, you can make good decisions, but understanding that you don't have the power. And so then you can't take on the shame and blame of when something happens, because you don't have full control in that way. Yeah. But that's hard.
It's really hard.
Very hard.
So exactly spot on, though. So that's some brilliance right there.
I that I got to go back to the BMI stuff. And I know we talk about BMI here a lot. And we all know it's trash. I think most people kind of have an idea where it originated from. But the fact remains that BMI is still heavily utilized
It's the gold standard.
Yeah,
right?
in the American healthcare system, and especially as it relates to offering people things that they need, healthcare interventions, joint replacement surgeries, other things of that nature. So, from someone like you who is like, I would say neck deep in this research and this information, like, what insights or thoughts do you have on our BMI-based system and how to navigate it when you need medical procedures and treatments that are essentially being denied to you because of this system?
Yeah. So yeah, BMI-based denials of care, ultimately what they are is holding healthcare hostage for a weight loss ransom that most people won't be able to pay.
Ooh.
And that's
Say
just
that
the
again,
bottom
please.
line.
Ooh, yeah,
That was so good.
Whoa.
BMI-based denials of care. It's holding healthcare hostage for a weight loss ransom that most patients will not be able to pay. Yeah. I went out a couple of years ago. I got my board certification as a patient advocate. And I don't do a lot of one-on-one advocacy. I did create a program recently for people to be trained as weight neutral advocates. But when I am doing individual advocacy, it's usually someone who's been denied a procedure that they need and want. Usually a surgical procedure. And so, first of all, the evidence that is used for this is typically terrible. I just found a page that Kaiser Permanente put out that said, oh, at a BMI under 30, your risk of serious complications for surgery is 7%. Over 30, it's 65%. They cited nothing. They gave no, and they acted like all surgeries have the exact same risk of serious. That's just bonkers. That's I
So if
can't.
your
I have
BMI
no.
is 29.5, it's 7%.
You're golden,
It's
7%,
30.1, and
Yeah.
it's 65.
Yeah, if you're on the threshold, if you could just lose that 0.5 pounds, it would drop from 65% to 7%.
As a logic brain statistician, like when you see something like I'm a little bit of a math guy myself, and when I see something like that, I'm like, it's impossible. It doesn't
Yeah.
work like that.
Possible.
Yeah,
Right?
that's usually my fiance Julianne is used to me just like screaming out of nowhere, like what? No. But yeah, so there's research that shows, for example, that people who have joint replacements have similar levels of satisfaction regardless of size, have similar levels of serious complication. Gender affirming procedures, there's good research that says that serious complications are roughly the same. There's also research that shows that weight loss prior to surgery does not improve outcomes, which is not surprising. If I said to you, hey, should we undernourish a patient for 3 or 4 months before surgery? Every surgeon would be like, yeah, no, you shouldn't do that, right? That will not improve their outcomes.
But that's the recommendation.
Yes.
Oh my
And
God.
beyond which, even if higher weight people don't have the same outcomes as thin people, which isn't surprising given again that the surgical tools, procedures, best practices, anesthesia, pharmacotherapies were all created based on research that excluded fat people,
Yep.
that is not a good reason to deny care. Right? Even if the outcomes are not the same or the complication rates are different, that should be an issue for informed consent. Not denial of care, while, by the way, we are desperately doing research to get better at giving care to fat patients.
That part. I think that brings up such a good point. I brought this up on the podcast before, but I had a little argument on my Instagram one day with a woman who my post was just about providing weight neutral care and providing spaces, within your healthcare setup that accommodate as much diversity in bodies as possible. So chairs that can fit people, tables that support higher body weights, blood pressure cuffs that are, bigger to fit around people so that you're giving them accurate healthcare, health information. So it was just supposed to be nice and encourage, better quality care for everybody, but especially for people in larger bodies. And this woman commented, I think she said she was a trauma, like ER nurse. And she was like, yeah, this is all good and fine until you have a big, overweight patient who's in the ER bleeding out from gunshot wounds, and you can't, you don't have the tools to help them and to stop the bleeding, and it's all on you. And I was just like, I was taken aback. But
Yeah.
for like sometimes when I'm feeling mature, I was like, you know what? Let me think about it from her perspective. I've not ever worked in the ER as a trauma nurse. I can only imagine, the trauma she experiences literally in trying to help save people's lives and all of, the scary things that you see, the people you lose. I have a good friend who's a trauma physician, and I've seen her when patients have passed, and she, it's overwhelming. So I tried to like be a little empathetic, and what I said to her was something along the lines of like, I've never been in your shoes, and I'm sure that providing the care that this patient needs feels impossible and feels really difficult. I was like, but as healthcare professionals, just because something is difficult doesn't mean we're not supposed to do it. Just because something is hard doesn't mean we just throw in the towel and say, you know what, fuck them. They should be
Yeah.
thinner.
Are they less valuable?
It's like they're
Yeah.
not less valuable. And the fact that we don't have the things that we need to accurately and efficiently treat these people, that should be justification for more, changes and shifts in what we're doing and how we're doing it. In the same way, because we would never treat another demographic, that's difficult to treat in these scenarios that way. Think about a very premature baby, who has tiny little teeny blood vessels, and, it's hard to work on them. It's hard to give them the life-saving care that they need. But we don't say, oh well, baby's too little. You know what I
Yeah.
mean? So it's
Yeah.
it's that same idea. Like, just because this shit is hard, it doesn't mean we're not supposed to do it. It doesn't mean these people aren't worthy of our effort. It costs me more money to get treatment tables that hold 600-700 pounds. But guess what? It's worth it as a healthcare professional because I want my patients comfortable. It costs more money to get sturdier equipment and more education. And it shouldn't, but it does. And that doesn't mean as healthcare professionals, like, this is what we sign up for, and this is what we should be willing to go the extra mile for. So that, that whole concept of like things being more difficult, maybe there's more complications if you're in a larger body, but there's ways we can address that and make that complication less if we do our part, So
Exactly. Like, reality is that nurse probably doesn't have what she needs to properly care for higher weight patients. Weight
Absolutely.
stigma is blaming the patients for that and suggesting that the patients shouldn't exist or the patients shouldn't expect the same level of care. That's where the weight stigma comes in. My thing, most of my audience for speaking is healthcare professionals, a lot of doctors, nurses. And so my thing is, let's get on the same team with our patients and against weight stigma.
Right.
Let's demand that we have what we need. I spoke to a conference of anesthesiologists, and in researching 30 years of anesthesia guidelines, the most recent that I found in 2023 said, we know that pharmacokinetics and pharmacodynamics are different in bodies with higher rates of adipose tissue, but we don't know how because they were excluded from the studies. So anyway, here's some guidelines for working with higher weight patients. Like, what it didn't say was like, dear God, somebody needs to do some research right now.
Right.
And this has been for 30 years. They've just been saying, meh, we know it's different. We don't know how. What are you going to do? Refuse them surgery. That's not okay. I also have to point out the ridiculousness of patients being refused surgeries that they need and want, but referred to weight loss surgery like they
That
don't use
one.
anesthesia over there.
That one.
Right. And so, and
What sense does it
somehow,
make?
you're telling me this is a group of people, Kaiser, with a 65% risk of serious surgical complications, but you were like, make a profitable business out of giving surgery to these folks, but only if they want to mutilate their digestive system to put it into a disease state surgically. Then you're full on, let's get these surgeries done.
Yeah.
But for patients who need a joint replacement, gender affirming care, other care, you're very happy to say, no, it's too dangerous to do surgery on you. That doesn't sound right.
Well, because it's worth almost dying if you're going to be thinner in the end.
Exactly. I actually got surgery for a patient. They wanted gender affirming care. They were denied, and they were referred to weight loss surgery. And we tried everything. And so my last ditch method, because it was all in the same facility, I said, look, because they had denied him for anesthesia risk. So I said, we wrote a letter and said, can whoever's going to do the anesthesia for the weight loss surgery just come down the hall and do the anesthesia for the procedure that this patient actually needs and wants? And
Just
it
do the
worked.
same
They
person.
did the surgery. I don't think this will ever, I don't know that this will ever work again. But it was just such a clear delineation. You're saying you can't do anesthesia for this patient, but you're sending them to get a surgery that requires anesthesia. So help me out.
Help me out.
That is wild.
Oh, that's good.
That's a good win though, and a good story for you.
It was a good moment, and like that patient deserved that care, but so many patients don't get care or don't have somebody who can advocate for them. I have, if it's ever helpful to somebody, I have my newsletter is weightandhealthcare.com, and I have, if you search the word hostage, you will find my piece about this, and I have collected groups of research for like lower spine surgery, joint surgery, gender affirming care, and they're all free resources. But it also has techniques for fighting BMI-based denials of care. So if that's helpful to folks, those resources exist, and you can reach out to me as well if I can ever help.
Oh, thank you for that offer.
Sure.
Speaking to this, self-advocacy is so important in healthcare these days. And so, what do you recommend for people who are receiving that weight stigma? Like, where do you start with this? I mean, obviously you gave some good resources, but like, how can people maybe just finish this podcast going like, oh, I've got a couple tools to like advocate for myself?
Yeah, for sure. So first of all, I want you to remember weight stigma becomes your problem, but it's not your fault. And I really want people to because that creates some space between what's happening and you that can help you to not internalize the weight stigma you're experiencing. To be able to say, this is wrong, this shouldn't be happening, and I have to navigate it because I need healthcare or this doctor to give me my prescription refill or like whatever you need. But like, this is not my fault and this shouldn't be happening. So making that distinction first and foremost, I think can really be helpful. For me, the sort of magic question that I start with when somebody's like trying to recommend weight loss or blaming something on weight is to say, well, what do you do for thin people who have this issue?
Yep.
And sometimes that's enough because you've asked a question, the provider is sort of in a mode to answer a question that you ask. And so it can sort of bypass. So you don't have to like argue about the research or any, just like, hey, thin people get this, right? What do you do for them? Let's try that.
Yep.
I also think it's helpful to remember that the right to informed consent and refusal is absolute. And so if your provider is saying like, I only, is just constantly coming at you about weight loss, new weight loss medications, et cetera, you can say, that's actually off the table. I'm exercising my informed right of refusal for weight loss intervention. So what are the other options? And you could just like move that conversation right along. Now, none of these are foolproof, right? I had a doctor in front of me, an orthopedist, my patient was having knee pain and said, well, what do you do for thin people? And he said, well, I don't have to talk to thin people about knee pain. Which is like,
lies.
I was like, be professional, don't laugh out loud. But like it's not, if it was my appointment, it would have gone very differently.
Right.
But like, obviously that's not true. Right? So none of these are foolproof, but again, often they can be helpful. And then having an advocate, and it doesn't have to be a professional advocate. It doesn't even have to be, honestly, anybody who knows anything. But for fat people and also for people who experience other types of like medical racism, ableism, et cetera, just having someone else with you, it can be like your cousin who knows nothing about medicine, but it can cause the provider to behave better.
I agree with
So
that. Yeah.
just bringing someone with you, there's some evidence to suggest that can improve your experience, even if they're not willing or able to like advocate for you specifically. So those are some
just
tips
having
and tricks.
another person in the room so that
Yes.
doctor is more careful about what they're saying.
Yeah.
Yes.
You feel supported.
Yeah. Yeah. And then I always think more privilege, more work. So I have a lot of privilege, white, cisgender, currently able-bodied, et cetera. But also I live in a place and I happen to have a type of insurance where there's a lot of doctors who are available to me. So if I don't need something urgently, I can blow up this relationship with this doctor if I need to. Right. And so I'm going to push for everything I can, knowing that the next fat person who comes along might not have all the privileges that I have. Right? So figuring out like, how can I use my privilege and how can I push for care so that the next person, some of my activism is just making a conversation for providers so uncomfortable that they never want it to happen again so that they will think twice before they say this thing to another
You're
person.
inflicting trauma so that
Right.
they don't inflict trauma. Right?
I'm like, this could happen to you at any time when you say this absolute nonsense to a patient. So like, let's do this right now. But yeah, so finding ways to use your privilege. If you are within the healthcare system, looking first, like, where do I have privilege and power and leverage to start making change in my own world? Maybe you can order bigger gowns, right? Maybe you can have a speaker come in for a lunch and learn about weight neutral care. And then how can we build coalitions to create more power and privilege and leverage to make bigger changes?
I love this. That was so many great tools for people. Going a little bit deeper and further back, because I hear you saying all this, and I would not want to be the doctor on the other side who was shaming people, because I have a sense that you do a great job at what you do. But for the people out there who they don't have that confidence, and they're stuck in that internalized shame that's associated with being in a larger body, how would you help someone like that take that step? Because, let's get real. A lot of people still look at their doctors like they're God, and they just believe everything that they say. And so we have to start with recognizing that's not the truth, and then building a little bit of self-connection and confidence in the first place.
Yeah. And it's like there's such a power imbalance in the patient-provider relationship. Right? And people will say sometimes, do you just hate doctors? No, I don't. I have such a special place in my heart for people who do healthcare, and not muffins in the break room grateful, but truly grateful for the work that folks are doing. But also, I have to say my first priority has to be the patient that they're harming because of the weight stigma that they've acquired. Right? And that they are now sort of weaponizing, whether they know it or not. A lot of times it's intrinsic. And so I think for people who are struggling, first of all, recognizing, no, there's a real power imbalance here. That's not in your head. That's real. And this person does have knowledge that you don't, right? Sometimes when I talk to doctors, they'll be like, well, you don't need me to tell you about that because you already know. And I'm like, no, I don't. I have very deep knowledge of a very specific thing. All the time you took to learn all the things, I took to learn about this one thing, which is why I know more than you about this one thing. I can't perform surgery. I don't know, what to do for every medical issue, right? So there's that piece of it too, that you are the CEO of your body. And I heard this first. I was part of a documentary shot by Daryl Roberts and called America the Beautiful, the Thin Commandments. And Daryl said that, you're the CEO of your body. And I think about that so often, these folks are on your team, and they're on your team because they have more knowledge than you, right? They're your C-suite of people with specialized knowledge. But when you walk out of that doctor's office, you are living in this body full time, and they are on to the next patient.
Yep.
Yeah.
And so you have the right to say, this is what I need, and this is what I want, and this is, I know you can help me, and I know you know so much more about me than so many things, but it's still my body. And I still have every right to love it and to fight for it, and it deserves my full-throated support.
Yeah.
And I
love
think,
that.
for me was when I realized, I have been hating my body for so long because it didn't look like a Photoshop picture of somebody else. But I hadn't had really any gratitude for all the things that it did for me.
Yeah. I'm curious if you think that the system is moving the right direction, and we're seeing more people becoming advocates like this, or if you feel like I think there's still a lot of work to do for sure, but I'm just curious if over the last 13 years doing this full time, are we seeing a positive direction and more people getting on board, or are we stuck?
I'm seeing a lot of positive changes. Look, I started giving these talks to doctors in 2009. And at that time, the Q&As were absolutely hostile.
Hey, sorry, Ragen, 1 second. Ben, should the volume drop down on her mic? You can see 100% fine?
Is it us?
I'm sorry, we kicked it.
Maybe we messed up.
Was she good? Okay. It just popped on me. Can you say something, Ragen?
Hey, can you hear me now?
Still super
She's
quiet.
still very quiet. Yep, she's quiet on my headphones.
If you feel it fine, Ben, we can make it work, I think.
Yeah.
Just wanted to make sure it was not something on our end. Okay, I'm so sorry about that. Yeah, we'll edit that part. We'll just jump in.
Okay.
So I'll just say, are we trending the right direction?
I'm seeing really positive changes. I started giving these talks to healthcare providers in 2009, and the Q&As at that time were absolutely hostile. right? People yelling at me, people walking out. And we did everything to decrease hostility. We were like, you can wear jeans. We're going to give you breakfast, like whatever it took to like
They were
try
like,
to
I rebuke you.
bring it really was like people standing up and screaming lies. Like it was just out of control.
I've got
and-
like holy water in my mind and like everything's happening.
It was for real a thing. Like nobody threw a shoe at me, but it got close. But now, as time has gone on, I'm seeing more and more providers who are aware of this, who are asking for this kind of training, and the Q&As are now much more sort of inquisitive, and people are interested, and they're sort of, sitting forward and leaning in to the conversation, which I think is super important. I also want to point out that there are organizations that have been doing incredible work. ASDA, the Association for Size Diversity and Health. Mm-hmm. There's a group called Medical Students for Size Inclusivity. Yeah. And recently, the Association for Weight and Size Inclusive Medicine, which is a physician and healthcare provider group. And by the way, that acronym is AWESIM, AWSIM, which is like my favorite thing. But there's a lot of people. I'm just one of many, many people doing this work. But I think that things are going in the right direction. Now, the weight loss industry, and in particular Novo Nordisk, is full court pressing this. Yeah. And so they're putting out research faster than I can analyze it. And that's part of the problem, right? They just get to have this, little abstract before the paywall or the press release headline that says, oh, this is true. And that's absolutely not true, but it's going to take me 15 hours and 12 pages of analysis to explain why it's not true. And so that's like what we're fighting against, is they're trying to use all of the weight stigma that people have internalized to say, oh, yes, everything you thought is true, and actually it's even worse, but it's okay because we're going to solve this for you with our weight loss drugs and our, surgeries, et cetera. So it's definitely a battle happening right now, but I do feel like I'm happy about our side.
I'm glad to hear you say that, because when Tyler asked the question, I was like, I question it, and I speak to groups, but not hardly at the rate that you do. So I think it's really powerful to have your experience and expertise in having been doing this for so long and seeing that shift and that trend. Like I spoke to medical students like 2 or 3 years ago about this topic, and they seemed interested and also doubtful. And I actually had a talk with like educators, because apparently there was this school. Someone followed me on Instagram. She was just saying that she was having all these issues at her school with the teachers and the staff, like really shaming kids about their school lunches and their habits, and really just instilling a lot of this weight stigma very early on. And she just saw it as a huge issue. So she had me come and talk to that staff. And when I tell you, like it was on Zoom, but like the folded arms, or the cameras off, or the lack of interest, like I felt like, ooh, like these are hard conversations to have with people who seem very comfortable and set in their ways and their beliefs, and not really ready to challenge them. So it is very comforting to hear you say that you've seen a huge shift in the way things are going. But you're right, the weight loss industry is fighting back, and they don't fight fair. That's just the reality. They're not going to fight fair, because this is about their bottom line. It boils down to money. And if you can create a problem and create the said pretend solution to that problem, which really just results in more problem, then you have a never-ending surplus of money and customers coming to you for the problem that you are pretending existed in the first place. So I feel like it's an uphill battle, but the work that you're doing and so many others in this arena is just admirable, to say the least. So thank you.
Yeah, thank
then
you.
Right
we gotta
back
have
at you.
conversations like this.
Yeah.
Ragen,
It's.
Go ahead.
Oh, I was just gonna say I feel lucky and honored to be in community with you and doing this work together, and I'm so grateful for everything you do. So thank you.
Oh, thank you, Ragen.
Ragen, where can our listeners find you if they want to dig in more, or maybe even join arms with you and see if they can make a difference as well?
Sure. So weightandhealthcare.com is my Substack, and I sort of write endlessly about this stuff. My speaking site is Sized, SIZED, for Success. And then I'm Ragen Chastain, RAGEN, on Instagram and Blue Sky, so you can find me there as well.
Awesome.
Love it.
Thanks so much for your time today and sharing your thoughts with us. It was really a fun conversation.
Oh, thanks for having me. Thanks for the work that y'all do and for letting me be a little part of it. I appreciate it.
Yeah.
Absolutely.